Hey, good morning, everybody. It's Dr. Bruce Gildery here with Health Source Chiropractic in Atascocita, Texas, coming to you on Thursday. It is September 4th. Hope you guys are having a great first week of September, and I'm ready for those first big cold fronts to come through. I don't know about you. This morning on my walk, it was actually pretty nice. The breeze was coming out of, I think, the northeast, and the air was drier, and it was gorgeous. So I'm looking forward to more days like that. Hope you guys have got to enjoy your Labor Day weekend, extra time off. I know all of our team did too, and we're back and ready to serve you guys. And today I want to talk to you about something we've been seeing a lot more of lately for some reason. We've always seen a fair amount of shoulder problems, whether it's people who are athletes and they throw or shoot basketball or volleyball or whatever it is, or people who do weightlifting and are having problems with their weightlifting because they're having such shoulder pain. We are seeing a lot more of that for whatever reason these days, just attracting it into our office, I guess. And in the past, we've always been able to get some pretty good results in treating those things. We're able to diagnose many of them as a rotator cuff strain. Sometimes there's a bit of a tear that we can see through an MRI. If they're totally ruptured, of course, nothing I can do about it. We have to send them off for surgical intervention at that point. But for the most part, most of them that way. There's a lot of them that have some tears. A lot of them just have a tendonitis that's developed as we get older or just whatever. And we have developed, especially over the past couple of years with the addition of our high-powered laser, some really productive protocols, effective protocols, I guess is a better word, for treating their shoulder pain. So one of the things that we will obviously do as a chiropractor is I'm going to adjust the whole neck and shoulder complex because if you have a shoulder injury right here where the rotator cuff tendon attaches, that doesn't just affect that area. Those muscles that make up that tendon come off of the shoulder blade. And if you're having pain here, you will start using your shoulder complex in ways that it's not normally designed to be used to compensate for it. That will affect how the shoulder blade moves. And there are plenty of muscles that attach from the shoulder blade to the spine, mid-back spine, and up into the cervical spine or the neck. So we have to address those things too, because if this starts to develop problems in your neck, if we just treat this and we don't treat the neck, we won't get as good of a result. So we'll always be adjusting necks and upper backs, and then we'll do some sort of therapeutic modalities. Most commonly, we're going to apply some high-powered lasers, I mentioned earlier. And we'll do a couple of things with that. We'll help reduce pain and inflammation, and as the patient improves, we change some of the settings and we focus more on speeding up the healing process. So it's not just the same setting for every single problem. Once someone is out of pain, we're going to be looking at improving blood flow to the area. Why? Because that blood flow brings in an abundance of nutrients that are needed for healing. As far as our rehab goes, we're going to rehab the neck, shoulder, upper back complex, okay? Because as we mentioned, we have all these connections of these muscles to the shoulder complex. So we'll be doing things from just range of motion exercises sometimes to stretches where you get in a doorway and stretch like this, which is something you can do regularly. Get in a doorway, arms like this, and just lean forward. Just lean forward so you stretch out the pectoralis muscle. We'll also do some strengthening exercise with using resistance bands and things of that nature, maybe some planking type things to create stability around the shoulder. There's just an abundance of things that we do that help us get some outstanding results on our patients with shoulder pain. So if you or someone you know and love is having struggles with a shoulder issue that's interfering with their life, maybe they can't sleep on that shoulder at night because it hurts too much, man, we would love to have the opportunity to take care of them because we know what we do works. And you know what? We also know that if what we do isn't working, we know where to get those patients to, okay? And because occasionally that does happen. Sometimes the problem's just too far gone and we have to have outside help from the medical profession. But most of the time, we're able to see outstanding results on shoulder problems right here in our office. Super excited about that. We've been taking care of necks and backs for decades, and shoulders too, but now we can do even better work with shoulders than we were just a couple of years ago. So that's good news for everybody. Hey, share this with your friends and family that may have shoulder issues, but also need to point out that if you're getting this on our regular weekly email, attached to this is a really good looking recipe for a keto white chicken enchilada casserole. I actually made this a year or so ago. It's really good and super healthy for you. And it makes a big casserole so you can feed a lot of people like your family, or you can have a lot of leftovers, or you can freeze some of the leftovers in serving sizes like I do oftentimes and reheat them at another time for a really quick meal. So check out that recipe. Hey, if your shoulder's bugging you, give us a call or share this information with people that you know are having some shoulder issues. We'd love to have the chance to take care of you and or your family. And thanks so much for the referrals you guys do send us. That means the world to us. I got patients bringing in their children to me for sports injuries. Actually, one of my new shoulder patients is the child of one of my patients, and this child plays basketball, and she's having a really hard time shooting with that injured shoulder that she has. So anyway, thank you guys for that. Today we'll be in from 2:30 till 6, so call us at 281-852-5600. Tomorrow on Friday, September 5th, it's Half Day Friday. We'll only be here till noon, so make sure you call early to get in, okay? Hope this guys helped you a lot. I hope this helps you guys a lot, and I ask again that you would just take the time to share it with some people, okay? Thanks, have a great week, and we hope to see you soon. Peace.